The color of your urine speaks volumes about your health. While it may indicate that your system is clean and healthy, it can also be a sign of several internal issues. Today's video is about decoding the color of your urine. Let's begin. Number 7. Yellow. A yellowish pigment in your urine is usually considered normal. The yellow color of urine is due to the presence of urochrome, which is a pigment that is produced when the liver breaks down the waste product of red blood cells called bilirubin. Bilirubin is transported to the liver, where it is conjugated with glucuronic acid and then excreted into bile. The bile then enters the small intestine and eventually makes its way to the kidneys, where it is excreted in the urine as urochrome. Urochrome is a byproduct of the breakdown of heme, a component of hemoglobin in red blood cells. Hemoglobin is responsible for carrying oxygen in the blood. When it is broken down, it produces several waste products, including bilirubin, which is then further metabolized to produce urochrome. The color of urine can vary depending on several factors, including the concentration of urochrome, the pH of the urine, and the presence of certain medications or supplements. Pale yellow urine typically suggests good hydration, while darker yellow urine can indicate the need for more water. However, the precise color of your urine is not a definitive indicator of your hydration levels. Other symptoms like thirst, dry mouth, and fatigue are much better indicators. Becoming dehydrated can be easy, especially during hot weather or physical activity. Severe dehydration can lead to various health problems, including dizziness, fainting, and heat stroke. Number 6. Blue. When your urine appears blue, it may simply be an indication that you have digested food made with blue dye. Certain medications are also known to have this effect. Methylene blue medication treats a condition where the blood cannot carry oxygen effectively, and cyanide poisoning, which can cause blue urine. There is a rare occasion where blue urine suggests a more urgent health concern. This is something known as familial hyperclampsia, a genetic disorder defined by an abnormally high quantity of calcium in the blood. Another urgent and equally rare cause is blue diaper syndrome, in which tryptophan is not sufficiently absorbed, stopping it from breaking down properly. As it moves through the intestines, it eventually transitions into a blue color. It can occur in some newborns who are fed tryptophan-rich formula. Number 5. Transparent. Clear or transparent urine usually indicates good hydration, as it suggests that you are drinking enough water. However, in some cases, completely clear urine may indicate that you are overhydrated and your body is running low on electrolytes. Electrolytes are important components of a balanced diet and help the body function properly, with the primary electrolytes being potassium, sodium, and chloride. They work to maintain your heart rate and fluid balance. Overhydration can cause an electrolyte imbalance in the body, leading to the kidneys working overtime to clear out excess fluids, resulting in clear, colorless urine. If your urine appears clear, it may be wise to reduce your water intake or take a break from drinking water to allow your body time to process what you've already consumed. This will help to restore electrolyte balance. Good hydration looks different for everyone. It's best to consult a professional if you have hydration or electrolyte concerns. Number 4. Orange. Orange-colored urine can indicate certain health conditions, but it's not always cause for concern. A few foods, such as carrots, sweet potatoes, and oranges, are rich in beta-carotene. The body converts beta-carotene into vitamin A. But when the pigments in beta-carotene are not fully metabolized, they can give urine a yellow or orange color. This is typically a harmless and temporary condition that resolves once the body processes and eliminates the excess pigments. If your urine is a light orange color, it could be a problem with your bile duct, which carries bile from your liver and gallbladder into the small intestine. Other symptoms such as jaundice, abdominal pain, and nausea are usually present when there's a problem with the bile duct. Dark orange urine could mean excess vitamin B in your bloodstream or a side effect of certain medication like phenazopyridine used to relieve pain in the urinary tract. Additionally, consuming foods that are artificially dyed can also cause your urine to appear orange. Number 3. Green. Green is rare, but possible nonetheless. Green urine can be caused by eating asparagus, although the vegetable is more likely to leave behind an odd smell. Like any color, green urine can also be made from simply eating food with green dye. Green urine can also be the product of certain medications. These contain chemicals that pass through the liver and kidneys, ending up as green urine. Pseudomonas aeruginosa is a type of bacteria that can cause urinary tract infections. This bacteria produces a pigment called pyocyanin, which is bluish-green and can cause urine to appear green too. Number 2. Brown. Brown urine can indicate several underlying health issues, including liver disease or hematuria, which is the presence of blood in the urine. If the liver is impaired, excess bilirubin may be excreted through the urinary tract, causing brown-colored urine. However, brown urine is not a reliable indicator of liver issues, as other factors like dehydration, medication, or certain foods can also change the color. Hematuria, or the presence of blood in the urine, can be caused by various health conditions, such as urinary tract infections, kidney stones, or tumors in the bladder or kidneys. There are 2 types: gross hematuria, where blood in the urine is visible, and microscopic hematuria, where the blood cannot be seen by the naked eye and requires the use of a microscope. Either way, hematuria is not to be taken lightly, as it implies a variety of issues, including trauma, inflammation, blood clotting, and cancer in the bladder or kidneys. Another reason could be porphyria. This is a rare hereditary condition that affects heme synthesis, resulting in an accumulation of porphyrins. Porphyrin accumulation can lead to photosensitivity, skin complaints, stomach pain, muscle weakness, and neurological problems. Excretion of porphyrins might also cause brown or dark orange urine. Number 1. Red. Red urine can signal a number of serious health conditions, including infection or tumor in the urinary tract. Red urine is often a sign of kidney disease that occurs when the kidneys have become damaged and cannot process normally. Aside from urine, you may also feel confusion, loss of appetite, fatigue, weakness, and shortness of breath. While red urine often serves as an alarming symptom of a greater problem, it doesn't always work out that way. In fact, red urine can be the product of beaturia, the experience of having red or pinkish urine after eating beets or food colored with beetroot extract. Only 10 to 14% of the population experience this and is more common among those with iron deficiency. The body can give many strange warning signs when something isn't quite right. Have you been keeping track of your urine? Let us know in the comments below.